This is The Gum Guru with Dr. Macon Singletary from North Raleigh Periodontics. This is a show about keeping your teeth and gums healthy and how a healthy smile affects your overall health. Today's episode is called, Are You Putting Off Dental Care Because of the Cost? It's more affordable than you think.
Welcome to the Gum Guru podcast. I'm Jason Kong here with Dr. Macon Singletary, and we've got a wonderful episode lined up for you today. And as you just heard, we're going to be talking about the cost of dental care. And Dr. Singletary, this is often, I would imagine, a pretty popular reason for folks to try to put off care. I think that and maybe fear are probably, if I had to guess, the top two reasons that people would put off an appointment to come to see you. Is that pretty accurate?
Oh, yes. You hit the nail on the head. Definitely. It's one of these things that ignorance is not necessarily bliss.
But we often don't know the true cost of these things because, one, usually we're not checking out dental bills and understanding the cost of care, but it's not just the bill. There's a cost in terms of the damage that could be done by putting things off, trying to ignore it, thinking, well, it's not that bad right now. I can power through this and maybe it'll just stay the same. But you know this very well. That's usually not the case. And when you're experiencing discomfort or pain, that usually means that things have gotten to a point that's further along than you might think.
Yeah, it's sort of like high blood pressure and glaucoma. If it hurts, it's too late. It's curtains. So yeah, you want to. It's interesting, and I tell everybody, what's the simplest way to take care of oral health? And when I tell patients to brush 4 times a day, it's not just oral health, it's systemic health, but also you're manipulating that bacteria that when it grows, you're going to react to it. And the early bacterial growth produces an acid, decalcifies the tooth, and causes decay. And there are 4 kinds of patients. Good teeth, good gums, their teeth are hard as rocks and they're not susceptible to gum disease. Soft teeth, good gums, they're the ones that they have decay pretty easily for various reasons. Bad gums, good teeth, and then the bad gums, bad teeth. That's your bless your heart group. You do not want to be in the bless your heart group because not only you got soft teeth, you're susceptible to gum disease. But it's simple to get an exam. I mean, everybody should have a dental exam and cleaning twice a year. I mean, that's just standard if you're not susceptible to gum disease. And when an exam is done, they may take out the device called the Explorer. I call it the medieval torture device. I used to sweat when the dentist pulled that one out. And they check for decay, and again, it may not hurt, but catching it early, one, is less expensive, and it can get complicated. It's one of these things that, they told me I had decay, but I decided it wouldn't hurt and I'll just wait. It is more affordable to do it sooner than later. It's just like gum disease. Gum disease normally doesn't hurt. It's like high blood pressure and glaucoma. Like I said, if it's hurt, it's curtains. But bleeding, swelling, bad taste is a sign of infection in the mouth. And you don't have to have bad taste. You don't have to have swelling. But if you're brushing and you get a little blood on your toothbrush, that's your body reacting to the bacteria and plaque. And you want to get that checked out. You want to get caught sooner than later.
Yeah, and you mentioned the brushing 4 times a day, and I got to be honest with you. The first time when we did the show and you mentioned that, I thought, 4 times a day, that seems like a huge burden. It's hard enough to brush 2 times a day, but when you compare that with the alternative of not doing that and the problems that you may have and the costs that may come down the line, well, hey, sign me up for brushing 4 times a day. Heck, I'll brush my teeth 8 times a day if it means avoiding a potential severe care down the road.
Exactly. And I had an individual in the other day that had treatment in my office about 15 years ago. Life dropped out for whatever reasons, and had a procedure done last November in one quadrant. And when she came in, she was having some bleeding, and she knew that wasn't good. And she had been over to the dental school. They had done some work, and she didn't want to have to go back to the dental school. And she knew bleeding wasn't a good thing. And actually, it was very early. And I said, look, you brush 4 times, and one of those times floss. Come back in 2 weeks, and I bet that area, it was isolated, that she was having, will get better. And all you need is to get your teeth cleaned twice a year. Deep scaling, root planing is the first phase of gum therapy, and it's non-surgical. And if we catch gum disease early enough, everybody has inflammatory gum disease. It's the number one health problem in the world. It's just you don't realize that it's there. And when somebody says, oh, by the way, you probably ought to see a periodontist, or you got some inflammation, that's periodontal disease. Everybody has bacteria in the mouth. Everybody's going to get bleeding sometime. And the damage, the result of the inflammatory gum disease is cumulative. The old saying, they're getting long in the tooth, is because they're 80 years old. They've had 80 years of life of exposed to bacteria day in, day out. And it's a slow progression. In tooth brush abrasion, that's why I tell patients use an extra soft brush. But you can braid the gum away.
We've titled this episode, in part, Why the Cost of Care is More Affordable Than You Might Think. Why is that? Why do we have this misconception of the cost of dental care?
I don't know. Maybe it's just a profile and the cost of crowns or implants. When you get caught early enough, it's diagnosed early enough, and you treat it more sooner than later, it's just more simple procedure. But also, the cost of health care is going up, and people hear horror stories of what goes on when they go into an office. And there are lots of ways to get treatment done, and some people have insurance, that helps. But it's like a coupon. I mean, it's not going to take care of all of it. But usually offices have a way of helping patients get through. They get estimates for the patients, or they have plans. There are companies out there that can actually help patients afford it in interest-free, for a year. So there are ways. You catch it early, it's more simple. And then when there is a cost, there are ways of working through being able to pay for it. I mean, it's not like most people in healthcare. I mean, at least in our practice, we try to help our patients when they come in be aware of this is like the exam is the first thing. This is what you got, and we try to do the most important thing first. And sometimes you can put off a procedure that's not priority, and you go for the more significant one, the one that's looks like it's going to be a problem quicker. And doing a full-blown case all at one time is not necessarily the case. So you can do it one bite at a time. You just get lots of patients come to them that this is the problem right here, and they point to it. Even though there may be other issues, look at that problem. Oh yeah, you got a chipped tooth. That can be taken care of pretty simply. But yeah, you can prioritize it. Unlike in medicine, if you got brain cancer, it's significant. Oral health, there's nothing too catastrophic in oral health. You can, if you catch it early enough.
Yeah, and I think one of the things that can also cause issues, or maybe the tendency to want to put things off, is that I can speak from experience with other medical professionals. Sometimes you feel like you're being pressured into a certain treatment, and that can also, I guess, create fear for people. But you don't do that. You usually lay out potential different options. You have your tool bag or golf bag of tools that you often refer to. That it's not just, okay, this is how we're going to do it. This is the only way we can do it. And if you don't do it, then you're up the creek. That's not how you operate.
No, and I always encourage second opinions. It's always good to get a second opinion. Different providers have their strengths and weaknesses, and they may be inadvertently or subconsciously looking at one thing and maybe something else needs to be done. But getting a second opinion is an option, and I encourage it. Patients come in, I want them to feel comfortable what we're recommending, and then also to realize and educate themselves, what's going on. I'm big into education. If you go to our webpage, I got a lot of information about different aspects of periodontal therapy and dental therapy. And so getting knowledge, it's sort of easy today. It's important in our practice is that you get a human being when you call. And that's one of the problems in healthcare today is that it's all automated or, it's unfortunate. That's where corporate dentistry and medicine sort of circumvents the human being initially. It doesn't mean there aren't good doctors there. It's just that it's always good to have a human being on the phone that you can talk to and say, this is what's happening. This is, and sometimes I can tell a patient, hey, take a photo of it and text it to me. I can see, and you don't have to come in. That's the great thing about technology today. And COVID was unfortunate, but what happened with COVID is we developed teledentistry, telemedicine. We could do it over the computers, at least initially, and that saves time and money there.
Yeah, that's a good point, especially for those who may have that fear of walking through those doors and the anxiety that may come with that for those who do have that fear. Well, this may get into our action step, but for those who are maybe putting things off because they may have some misconceptions of costs, what should they do? What would be the best step to take?
Yeah, the best thing to do is just call a dentist up if you hadn't had consistent care and get an examination. Say, I need a dental exam. And they'll get you in, and they will probably need a radiograph eventually, but they can pretty much tell you right off the bat, okay, this is what we're seeing, and then help orchestrate a treatment plan for the patient and gear it toward the patient's need. But the action step is just, I'm a dental phobic from way back. I turn red and swell when I walk through a general dental office. It's just that fear I had. But once you understand what can happen, they're there to help you. You get the information. Doesn't mean you have to do anything right off the bat, but get the information, and then if you feel uncomfortable, always get a second opinion. And
don't wait as well, because there's going to be more availability of the tools in your golf bag if someone comes in early, as opposed to really putting this off and letting things get worse.
Yep.
Yeah, that's wonderful advice for us to steps that we can all take when it comes to our dental health. Well, before we wrap up, I know we talked just briefly about the importance of second opinions, but I really want to spend a little bit more time on that, because you've experienced and heard stories where coming in to see you for a second opinion has really been a game changer for a lot of patients.
Yes, that's happened several times, but one particular case, she went into a corporate office, and they said, this is, we're going to take your teeth out, we're going to do implants and restorative work. And she was distraught. She felt like she was going to have to mortgage her house just to pay for it all. She came into my office for a second opinion, and yes, she did have some periodontal problems, and that's another factor. When you're spending money on treatment, is the treatment going to be good long term, depending on your susceptibility, depending on how you react to the bacteria. Everybody's different. You can't cookbook. You can't just look at a case and say, oh yeah, we're going to do this. She got a second opinion with us, and it turned out that, yes, she did lose a few teeth, but she actually ended up with an upper and lower partial, and she's ecstatic. She's got her smile back. She just hadn't been to a dentist, and sometimes it can get overwhelming when you see a patient initially that, COVID knocked a lot of people out of getting oral health. And some people hadn't had their teeth cleaned 5 to 8 years, 10 years, and they come in and they've got inflammatory gum disease, and you go, whoa, you're going to lose all your teeth. Not necessarily. You take it one bite at a time, one step at a time. She came in for the second opinion and said, well, look, let's try this. Let's do my golf bag of treatment options. Just do the root plane club and see how you respond. And she responded. We still had to take out a couple of teeth, but then the other teeth tightened up. And she's one of these people that if she had pursued the initial consultation, she would have been probably a dental cripple by now, because of the fact that she did have periodontal disease, and some of those teeth didn't need to come out. And implants are a great option. They are an option, but they're not for everybody. And so getting a second opinion when you get a big treatment plan recommendation is always a good idea. Somebody always has a different look at it, a different view. It doesn't mean that maybe that treatment was appropriate. It's just maybe there are other options and not as expensive.
Yeah, and if you are presented with a rather large treatment plan like that, there's really no downside to getting a second opinion. Now, obviously, if you're presented with another option that's just as effective and not quite as expensive, who wouldn't want to sign up for that?
Yep.
Yeah, that's wonderful advice. Well, that will do it for us today. Thank you so much for joining us for another episode of The Gum Guru.
If you want to know more about getting a second opinion and options for planning out your dental work, check out their website at northraleighperio.com. If you have other questions you'd like to have answered on the Gum Guru podcast, send them to contact@northraleighperio.com.